What's it going to be like after your loved one dies? In this video, I'm going to talk about two separate things. The first part is what happens right when your loved one dies on hospice, what actually happens and what you should do. The second part of the video is what happens in the days, weeks, months to come after your loved one dies. Death is not an emergency. Once you notice that your loved one has died, you can pause. Please give yourself permission to not do anything. Well, you can feel scared, but know that it's all normal. Whatever you're feeling is normal. And remind yourself, hear my voice when this happens, telling you that you can pause. You can pause. There is nothing that has to be done in that moment. So many people make it a chaotic moment because it feels scary and it's so unknown. So I want to take a moment to remind you that it doesn't have to be that way. You can pause, you can be with your loved one who just died. You can get your sister in the bedroom if you need to, or whoever's in the house, you can let them know what's going on so you can all be together. You can mourn together in that moment. You don't have to make any quick decisions or quick phone calls. So know that. Okay. Now, once you've done all of that, you can call the hospice company. Please call the hospice company because we can help you. So you call the hospice company and we can come out and kind of help you with the process of what happens next. Now, depending on where you live, some states make you have someone come out and declare your loved one dead. Some states don't make you do that. So it just depends. But I always say call the hospice company because they can help you take next steps. Once the hospice company is there and declares your loved one gone, they can call the mortuary you have in place. If you don't have one in place, we can help you get one in place. And then we can work with the mortuary on how soon or not soon they come. Again, there's state regulations for how long they can wait. But generally speaking, it doesn't have to be rushed if you don't want it to be. So please take your time and try to, for lack of a better word, almost cherish that moment. I really do think when we rush through it, we forget a lot of things and we kind of regret we rushed through it. So try to be present in that moment with your loved one and then with your family around you if there is family around you. So that's what's going to happen right when your loved one dies. Once they are removed from your house, now what? Right? Now what? Please know just systematically, the hospice company will start helping you plan things as far as getting the equipment out of the house, getting rid of medications, things like that. So we can help you with all that. We'll help you get the death certificates, the things that you need to actually put in place. The hospice company can help with that. Also, please know that hospice gives you bereavement services for up to a year after your loved one has died. So please take advantage of that. This is the tricky part, I think. The afterwards. You know, the first few hours, I feel like so much is happening that it's almost like it doesn't feel real, right? And then in the next coming days, weeks, months, your mood and mind and body are going to shift. And I want you to know how normal it is to feel weird, for lack of better words. You may feel nothing. You may feel angry. You may feel sad. You may ruminate on one specific thing you keep thinking about. Like, I saw my mom do this and I can't stop thinking about it. Although all of those things are uncomfortable, it's all really, really normal. Death and grief are so complicated. You can prepare. So I always talk about preparing for death, right? You can do all the things to prepare for it, to make it as peaceful and as sacred as possible, but you still don't know how it's going to feel when you lose your loved one until you do, right? Until it's done, until it's happened. And you probably have already been grieving before they were gone. Right? So it's been this whole process. You may feel numb. You may not feel anything at all. So many people talk to me about how they don't feel anything. And it took them a year to start feeling something. Please know that all of that stuff is normal. If you're the person who has to make all the calls, you know, to tell the friends and tell the aunts and tell the uncles, tell everybody that this person is now gone. That is hard. That's uncomfortable. No one teaches you how to do that. So please know that the feelings that you're feeling around it, or how you don't want to do it, or you feel uncomfortable, or it makes you cry, whatever it does, all of it's normal. All of it's uncomfortable. And I think people think because they feel bad or because it feels so awkward, they must be doing it wrong. And that's just not true. It's just hard. It's just hard to do. Like Glennon Doyle always says, we can do hard things. And that's what you're doing. You're doing the hard thing. And sometimes it feels okay and sometimes it doesn't. Another emotion that I hear a lot of people tell me they feel after their loved one dies, specifically if it's been an extended illness, is that they feel relief. They feel relief when the person finally dies. And then the second they feel relief, they feel guilt and shame for feeling relief. And then they don't want to tell anyone that that's what they felt. And then that sticks with them for so long. I want you to know, if that's what you felt, you are very, very, very normal. And to feel guilt and shame afterwards is also very normal. When someone has an extended illness like that, a lot of times we already do our grieving before they're dead. And then we watch them have this life that they never would really have wanted. When they finally die, you think, well, I'm glad their suffering is over. So you feel relief. And then you feel guilt and shame for feeling relief. Again, I'm just trying to describe these moments because this is what I hear my patients' families tell me. That's like the most common thing I hear. So if you have ever felt that, very, very normal. I think in general, what happens is people judge how they're doing this grieving thing. And the judgment causes them to feel even worse. Right? So like you're grieving this way, you're grieving that way, and then you're judging yourself for how you're grieving. I think I kind of liken it to when people have young children right in a row. So they have like one baby and then a second baby. And it's so hard. A lot of my friends always tell me how hard it is to have like two toddlers running around. And they automatically think because it's so hard that they must be doing something wrong. Or like, what's wrong with them? Why can't we get this right? This feels so hard. I feel like grieving is like that. Grieving is just hard and it's confusing and everyone does it differently and it feels bad sometimes. So when it feels bad, you automatically think, I must be doing this wrong. How come other people seem to get over things and I can't? Or how come my brother seems to be grieving differently than I am? How come they can talk about it, but I can't? Just know that all of these complicated things, again, this whole video, I just want to keep saying it's normal, it's normal, it's normal. Nothing is wrong with asking for help. When we feel bad, at least for me, when I feel bad, I want to retreat. I want to isolate and be alone. But that's probably the last thing I need. I am a big support group person. I love support groups. I think they're totally underutilized. I love therapy too. Therapy is great. So if you'd rather do it individually, that's great too. But I also think support groups are amazing because it's basically just people going through the same thing, all talking and supporting one another. And I think it's a beautiful thing. It's really helped me. I've done a lot of different support groups. They always help me so much. I always never want to do it. And then once I do, I feel so much better. So if you are relating to this video at all, please think about that. Think about finding support groups with people who are going through what you're going through. There are very specific support groups out there. People who have lost a loved one to ALS, people who are caring for someone with dementia. There are very specific support groups out there that can make you not feel so alone. I think the moral of the story is there is no right or wrong. This is just a difficult time. Grief is difficult and you need to lean into that. You need to accept that, accept how you're grieving, and then ask for help if you need.